Hello, Maryville. I'm Tamika Jackson. This is my best friend. She has graciously volunteered to assist me in performing my head to toe. So without further delay, thanks for tuning in. I'll get started. So first we're going to start with inspection and palpation of the head and the scalp. I'm going to just inspect it and note that the hair seems to be evenly distributed. There are no open sores or open lesions. I'm going to do some palpation here. And noting that there are no masses, no lumps, no gross abnormalities there.
I need a nurse to room 20, please. A nurse to room 20.
We're going to go down now to the face. I'm going to inspect the face, and I am noting that her skin color is of normal ethnicity. Her eyelashes and eyebrows appear to have grown in proper directions. As far as the brows, they've grown in an outward manner. The lashes have grown in an outward manner. Hair appears to be evenly distributed here. There are no sores, no lesions. I'm going to palpate now, just my face, noting any type of lumps, any type of pain, any type of masses. There are none present there. So I next want to move to my eyes. I'm going to ask you to just kind of stare over my shoulder here, and I'm going to inspect just the eyes overall in general. So I'm going to use my pen light here to look at my pupils. Okay. Pupils appear to be equal, round, and reactive to light. They briskly accommodate to light as well. I noticed that sclera appears to be white. Conjunctival sacs appear to be pink and moist. Sorry here. Going to palpate now my lacrimal apparatus here. Okay. No fluid is noticed there. Going to also palpate my frontal maxillary sinuses. No free fluid there either. No crepitus. The next thing we're going to do is do the cover-uncover test. So I'll have you just stare at a fixed gaze point at the wall and cover one eye. Okay, uncover. Cover other eye. Uncover. All right, and I notice that the eyes move symmetrically at the fixed point. There is no drooping, no lag, and no nystagmus present. Next thing we're going to do is cardinal gazes. All right, and the eyes move in a fixed direction symmetrically. The next thing I want to do is my ears. I want to inspect both ears bilaterally, noting that they both sit symmetrically in the same alignment, and I'm going to palpate my auricles, noting that they are freely movable. There's no drainage. There's no gross abnormalities present when I move it. There's no just no abnormalities there. Next thing we're going to do is the whisper test. So I'll have you to cover one ear, and I'll whisper a word and you repeat it. Apples. Apples. Okay. Uncover. Cover the other ear.
Oranges. Oranges.
All right. And the whisper test appears to be normal. Next thing we're going to do here is I'm going to use the tuning fork here to conduct air and bone conduction to note any abnormalities. And I'm going to strike the fork, and you tell me if you can hear the vibrations on the left side, the right side, both sides, neither sides.
Both sides.
Both sides. That's a normal finding there. Next thing I'm going to do is strike the tuning fork and place it on her mastoid bone. You let me know if you can feel this.
I can feel it.
Okay. Let me know when it slows down.
Slow down.
Okay. Going to move it to her shoulder bone.
I can feel it.
You can feel that? Okay. That's a normal finding there. The next thing we're going to do is move to the nose. I note that the nose sits mid-face. Nostrils appear to be They appear to be symmetrical. We're going to do the nasal patency. So I'll have you to cover one nostril and breathe in and out. Okay, and the other one. Okay, nares appear to be patent there. I am going to look up in the orifices here. And I'm going to note that the hair is evenly distributed. The septum sits midline. There's no deviation there. I don't see any polyps. I don't see any kind of nodules or any kind of sores or drainage or any abnormalities there. The turbinates are also of normal findings. The next thing we're going to do is I'm going to palpate TMJ. Go ahead and open your mouth. Okay. And just basically close it. Palpating for any kind of pain, any crepitus. Was that painful for you?
Not at all.
Okay, great. So that was a normal finding there. The next thing we're going to do is move to the mouth. I'm going to inspect the lips. They appear to be moistened, of normal color consistency. Next thing we're going to do is I'm going to look inside of the mouth here. So say "ah" for me. Okay, so I'm just going to note that her buccal and gums appear to be pink, appear to be moistened. There's no oral sores, lesions, no cavities. Just noting the condition of the teeth. All are present, of normal color, of normal size, of normal shape there. Go ahead and move your tongue for me. Okay, and then I'm just going to look underneath the tongue to inspect for any oral cancer, and everything appears to be normal. Tongue is pink and beefy and moist. One more "ah" for me. I'm sorry. Gonna gag you. Okay. And her uvula moves in an upward manner when she says "ah." The tonsils were noted to be of normal shape and color and size. The hard and soft palates were noted to be intact, no abnormalities there. And the pharynx was also noted to be pink and moistened and no abnormalities there. I think that kind of sums it up for the mouth there. The next thing I want to do is I'm going to have you to do a series of commands for me. Close your eyes really tight. Okay, open. Clench your teeth. Clench. There you go. Smile really big for me. Stick out your tongue. Okay, and then the next thing I want you to do is puff your cheeks and wrinkle your forehead. Okay, so all of those are noted to be normal. Those were my cranial nerves. Sorry about that. So those look good. So the next thing we're going to do now is we're going to move to me palpating the lymph nodes here. Preauricular here, can't feel any. Postauricular. Tonsillar. Okay. My submental. My mandibular. My occipital. My supraclavicular, infraclavicular, my deep cervical chain here, and I can't feel any lymph nodes there, so that's a normal finding, no swollen lymph glands or anything like that. Next thing we're going to do is move to the neck. I want to inspect the neck from a front view and notice that it sits, looks even, symmetrical. It does not look enlarged. I'm noticing the trach, which appears to sit midline. And I'm also noticing my thyroid gland, which upon appearance does not appear to be enlarged. I'm going to palpate now. Carotid artery. One at a time. I want her to pass out. So noticing that those are both equal bilaterally and strong. Next thing I'm going to palpate is my thyroid gland. And like I said, there's no enlargement. That's a freely movable gland. I also palpate it from the back, or inspect it from the back. I should say inspect and palpate. And once again, no gross abnormalities there. She's not at a 30-degree angle, but she's young and otherwise healthy. There's no jugular vein distension at this point in time. Let's see here. So the next thing I want to do is we're going to go ahead and move to the chest. I'll inspect her respiratory rate and effort, and it's noted to be even and unlabored respirations. The next thing I want to do is percuss for expansion and tactile firmitus. So we'll do tactile firmitus first. Or excuse me, we'll do expansion first. So I'm going to place my hands here. I'm going to have you take a deep breath. And out. Okay. And I'll have you take another deep breath. And out. All right, so that was noticing outward expansion as well as just the regular expansion, and both were noted to be normal. Hands move symmetrically in both directions. And so that appears to be normal. Next, tactile firmitus. I'll have you to say 99 while I do a series of hand movements.
99, 99, 99,
Arms out.
99, 99, 99,
Okay, we'll go from the back. You put your arms down.
99, 99, 99, 99.
All right, and that appears to be normal vibratory response to tactile firmitus there. No crepitus noted, no gross abnormalities there. While I'm back here, I'm going to start with percussion of the back. So, or excuse me, I'm sorry, palpation of the back. So I'm just basically just, I'm sorry, percussion of the back. CV8 angles is what I'm trying to say. I'm so sorry. I'm stumbling over my words here. So I'm just going to palpate for any tenderness there. You notice any tenderness back there?
No tenderness.
Okay, excellent, excellent. All right, so now we will definitely start percussing. I'm going to percuss anteriorly. So listen for any changes in sound. And laterally. I'll go to the side here. Okay, then the other side. Okay, then I'll do the back. All right, so that appears to all be normal there. And also, while I'm back here, I need to check my diaphragmatic excursion. So once again, I'm going to place my thumbs together, have you to take a deep breath, and out. And once again, both hands move symmetrically with the rise and fall of the chest wall. Next thing I'm going to do is auscultate my lung sounds. Deep breath. Now while I'm up here at the neck, I'm going to also auscultate my carotid arteries for any roots and my thyroid gland for any type of thrills or heaves. All right, and all that is noted to be of normal findings. I'm going to inspect laterally now. Deep breath. Okay. And then this lateral side. Deep breath. All right. Then from the back here. Deep breath. Okay. And also while I'm back here, I am just going to note any the spinal column for any kind of curvature deformities or any kind of alignment abnormalities, and just kind of palpate that. and everything seems to be aligned. I'll have you to kind of bend over a little bit. Okay. And also do a visual inspection, and everything is noted to be aligned as well. You can sit up there. Okay. All right, so that's noted to be normal. I'll have you go ahead and shrug your shoulders for me. Okay. And that looks good. And while she was shrugging her shoulders, I was kind of pressing down for resistance there. Go ahead and next we're going to, we'll do the chest wall now for auscultating cardiac sounds. So I'm starting at the aortic, moving over to the pulmonic, then down to Erb's point. Okay, next is my tricuspid.
I'd like to order patients GI rounds, call 41587.
And then finally my
Patients GI
mitral
rounds.
at my fifth intercostal space. Okay. And then I will also palpate precordium, the fifth intercostal space. Any kind of heaves or pulsations or anything like that. Okay, and that is noted to be normal. The next thing I want to do is also noted that the heart rate and rhythm were within normal findings. No kind of murmurs or any abnormal cardiac sounds, friction rubs, anything like that. Next thing I'm moving down to is the upper extremities. I'm just going to inspect and palpate here, noting that skin is warm, dry, normal in color for ethnicity. Palpating my radial, post-bilaterally, ulnar, brachials. Okay, we're going to do some resistance here. I'll have you to put both arms up and go ahead and push upward. Okay, pull downward. Okay, squeeze my fingers. All right, and then strength and grips are noted to be equal bilaterally. The next thing we'll go ahead and do is I'm going to inspect her nail beds, which are literally pink. And so we look for pink nail beds. Turgor is normal. Cap refill should be less than 3 seconds. The next thing I want to do is go ahead and have you to lie down. And the first thing I want you to do is we're going to test your brachial reflexes here. Okay, so you just kind of feel for that brachial muscle and kind of arm is in a dependent area, and I'll kind of strike it. Okay, that was a good reflex there. And then the next one is this one. Go ahead and just relax for me. And once again, brachial tendon there, strike it. It's a good reflex there. Next thing I want to do is I'm going to inspect my abdomen, providing privacy for my patient here. I'll lift this all the way up, sorry. All right, so the next thing I want to do is just inspect the abdomen. Inspecting contour. Abdomen appears to be flat. I don't see any bulges. I'm going to have you to slightly lift your neck up. Okay.
Patient in room 19 is calling for assistance.
Go ahead and lay back. Okay, so I don't see any bulging when she lifts her head up, like that could indicate hernia or anything like that. No peristaltic wave movements, no pulsations noted. So the next thing I want to do is auscultate my bowel sounds. I'll listen for 2 minutes per quadrant. Bowel sounds should be noted 5 to 35 times per minute. Okay, and bowel sounds are noted to be equal, not equal, I'm sorry, but present in all 4 quadrants. Next thing I want to do is auscultate for my aorta. Listen for any thrills or heaves or brutes, and none are noticed. The next thing is my renal arteries bilaterally. Okay, and then my iliacs. Okay, and then I'll listen a little lower for my femorals.
Patients in room 20 and bed 7 would like assistance. Room 20 and 7.
Okay, and all findings there are normal, no thrills or heaves or brutes noted there. The next thing I want to do is percuss the abdomen for a number of different things. So let's just do this here. So I'll start down here. And there are no gross changes in me noting, any dullness to resonance or hyperresonance to dullness, which is a normal finding for her. The next thing I want to do is percuss for my liver. So I'll go over to her right side, and we're going to do right midclavicular here, and I'll start up a little higher here. So. Okay, about right here is where I notice my first change in sound. Okay, right here is my next. So from here to here is my liver span. Looks like it's probably about 4 to 5 centimeters, which is normal. And then my spleen, we'll go over to the left side here, and it's kind of like a left mid axillary that we're gonna go for here. So just kind of, sorry. All right. And next thing we're going to do is try to do palpation. We're going to do light and deep palpation, as well as trying to palpate the liver, edges, and the spleen. So I'll start with light. Tenderness there. Okay. Also palpating the abdominal muscles there. And the next thing we'll do is bimanual deep. Okay. And I'm going to put my hand underneath her back. I'm going to have you to take a deep breath, honey. Deep breath in. Just palpating for those splenic borders. And normally you shouldn't be able to palpate it. And thin people, maybe. She's thin, but she's not that thin. And then the next thing is my liver. Deep breath. And just palpating there. And I can't palpate any liver borders there. Last thing we're going to do is looking at her lower extremities here. Color, just inspecting here in general. There's no sores, no lesions. Doesn't appear to be any gross abnormalities. Her skin is warm, dry, normal for ethnicity. Palpating for my popliteal. Both are equal and present.
Patient in room
Fetus,
14 is
fetal pulses.
calling for assistance. Please, 14.
Okay. And my last set of pulses back here. And all pulses are noted to be equal and strong. Go ahead and lift this leg up and resist. Okay. And then pull down, resist. Okay. Same thing with this. Lift up, pull down. Okay. Point your toes towards me. Okay. And then point them up towards your head. Okay. Strength is equal bilaterally. Next thing we're going to do is our reflexes here. So I'm just going to have you to slightly flex this knee, just like that is fine. We're feeling for the popliteal, cat bear, and just to kind of hit it somewhere on there. Okay, good reflex. Same thing with this one. Okay. Same thing. I'm going to strike that popliteal right there. Maybe not. Okay, there we go. All right, last thing is Achilles tendon, and I'll just kind of lift her leg up here. And we're just going to strike the back of it. And it's normally, let's try it again. Okay. And one more time over here. Okay. All right. All right, so the last thing that I want to do is touch sensation to the face. So I need to know if you feel this on both sides. Okay, here, there, both sides. Yep. All right, that is noted to be normal right there. And I think that this concludes my head to toe assessment. I hope I passed. And thank you so much. Glad it's over. Have a good day.